My name is Darius, and I'll be your nurse today. And I'm here to do a respiratory, a cardiac assessment, and I'm here to educate you on the importance of restraints. First and foremost, I'd like to see, can I get your name and date of birth?
Cynthia Smith.
Can I see your wristband, please? Ms. Smith?
Her date of birth is 6/2/1930.
Yeah. 6/2/19 what?
77.
1977. All right, thank you, Ms. Smith. All right. Do some hand hygiene. Get that part visible. Pretend like I did. Simulate giving the patient some privacy. All right, Ms. Smith, I'm here to do a respiratory assessment, a cardiac assessment. I'm here to give you a brief explanation over the importance of some hospital restraints. But first, I'd like to ask you, are you experiencing any pain today?
Yes.
You are. And what would you rate your pain on a scale of 0 to 10? 1 to 10.
3.
3. And about where would you say your pain is?
My back.
Your back. Upper, lower, is it all around?
Lower.
Lower back. And what were you doing when you first experienced this back pain?
I was picking up a box.
Do you perhaps take anything to alleviate your back pain?
No.
And about how long your back pain lasts when it does?
Off and on about 30 minutes.
And you are experiencing that pain right now as we speak?
Yes.
Yes. Okay, thank you. And are you on any sort of medications that I might need to know about for performing your assessment?
I take a blood pressure pill.
And do you know the name of that medicine off the top of your head?
Yes.
Can I get the name of it?
Metoprolol.
Metoprolol. All right. How are you feeling today, like mood-wise? Are you in a good mood? Are you anxious?
I'm in a good mood.
Always good mood. All right, Ms. Smith, I'm going to start off with your respiratory assessment. It's going to consist of me checking your respiratory rate, your effort of breathing is how much work you put into breathing, your pattern, and then I'm going to auscultate breathing sound at different points in your chest and in your back. But first, I'd like to ask you, are you experiencing any shortness of breath today?
No.
Okay, good. Have you experienced any shortness of breath recently?
No.
All right, good. Okay. First, I'm going to chest you. I'm going to check your breathing pattern on your anterior side, and then I'm going to check it on your posterior side or your back. Is that okay?
Yes.
Okay. All right, can you take a deep breath for me? All right, deep breath. Deep breath. Deep breath. Deep breath. Deep breath. far, so good. All right, I'm gonna go behind you and I'm gonna check your back. You mind if I pull your shirt down a little bit in the back, okay?
Yeah.
Okay. And I'll ask you to take your shirt off in the video. All right, deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. All right, good. Your breathing is bilateral and even. I didn't pick up any crackling or popping. It's great. And I'm gonna give you some education on some breathing techniques. One is when you're admitted to the hospital, they might give you what's called a spirometer. Is kind of like a little plastic box with a tube hanging out. They want you to breathe in usually around 10 times every hour. Some people say every commercial break during your favorite shows, and that's just to help you with deep breathing and help strengthen your lungs. And you have another technique called the turn and cough. That's to clear sputum out your airway or any other type of particles that might be obstructing your breathing. Have you had any? Have you coughed up any sputum recently?
No.
None disease, no allergies, nothing.
No.
And for that respiratory rate, I got a 12.
Okay.
All right. Now for your cardiac evaluation, first we're gonna check to see if you have any distension in your jugular vein in your neck to make sure you're not having any heart problems. Because then we had to get you admitted to the hospital directly. And then I'm going to palpitate some of your pulses, some of the different spots on your body,
Okay.
specifically your radial, posterior, tibial, and dorsalis pedis, the last two on your foot. Gonna check for capillary refill, check for edema, and I'm going to oscillate some of your heart sounds. But have you had any racing or skipping in your heart?
No.
Any chest pain?
No.
All right, thank God for that. First, I'm gonna check your jugular vein distension, and then I'm gonna oscillate your heart sounds, and then I'll go to capillary refill, and then I'll check all your different pulse sites. Okay?
Okay.
All right. If you don't mind, could you lean back just a little bit? Thank you, and turn your head to the right. Just gonna shine this light on you, make sure your neck is bulging. It's not that good. And for the heart sounds oscillation, I'm going to start at your aortic valve. That's your right second intercostal space. Then I'm going to go to your pulmonic, Erb's point, tricuspid valve, and your mitral valve. Next you do this second on your right, and second on your left, and then third on your left, fourth on your left, and fifth on your left. Your intercostal spaces. And for the purpose of the video, I will not expose you. Let's see. Hope I can get these shirt. Mind if I lift your shirt, man?
Yeah.
It's good. No heart murmuring. Your pulse sounds strong and lively. If I was going to check your aortic pulse, I would have got it down there at your mitral valve. Not your aortic pulse, what's the one? I think it is the aortic pulse. I can't remember. Now I'm going to get your assess your different pulse sites, and then I'm going to do your capillary refill, and I'm going to check for edema. Is that okay?
Yes.
Can I have your arm, please? Thank you. Alright. I'm going to check your brachial. My left hand so I can see my watch. So far, your pulse has been a little stronger in your radial site, but sometimes that can be expected. Or I'll give you like a +3 in your wrist and your radial site, probably +1 in your brachial. Can I remove one of your shoes, please?
Yes.
Now I'll give you a 2+ in both of those sides on your foot. All right. But since I already got one of your shoes exposed, I'm gonna check for any edema, see if you have any fluid retention. I'll check your capillary refill while I'm down here. Look good to the foot, no edema. And check your other foot. Everything good so far. I check your refill, capillary refill in your hands. If you feel uncomfortable at any point, you just let me know.
Okay.
Check for edema. And no swelling. No swelling and good refill in your hands. So far, beside that back pain, you seem to be pretty good shape. All right. Get all that. I'll give you some little brief education on some of the restraints we provide at the facility. We have 4 different types of restraint: physical, chemical, environmental, and personal. Physical restraints, that's your posy vest, your wrist restraints. There are more other mechanical restraints we have to, I guess you could say, to keep a patient in bed. Sometimes they might be, like for example, an older person with a UTI. Sometimes they might get a little confused and they might act in an erratic way that they might not usually act. Or sometimes people might be come down from a drug episode, and we might have to just restrain them just a little while. Of course, got to have doctor's orders for that. Usually, in most cases, except extreme cases where they're being violent with us. Chemical restraint, those are, of course, your medicines. And your environmental restraints, those are your, I want to say it's your bed, like putting up the bed post, just to make sure your patient don't fall out of bed. Some patients are at a high fall risk. I consider all patients at a high fall risk, but you never know what happened. But sometimes some people are at a higher risk than others. And personal restraint, we got about